Namaste, Namaskar, good morning and good evening, my dear friends. A warm welcome to one and all of you. And I want to thank you that you're taking your time and you're staying connected through these online sessions. And I only hope that you're doing very well. Even if you are not doing very well, maybe your job situation or a health problem or some other issues that is bothering you, do not worry. The reason why we are always having these sessions is to convey one important point. In this world, in this life that we live, there is no shortage of problems, there is no shortage of issues, but there is shortage of an attitude called as overcoming the problems, right? And that's what we are time and again conveying, how to overcome the problems. And these are the sessions which will mold a person. Very, very important thing, we got to mold our attitude. And molding our attitude is not left to another person, it's your responsibility. It's your own problem that you need to deal with, and you got to be responsible. Age does not matter at all, it's only an attitude that you need to inculcate or instill. If you plug that right attitude, that right chip, right, called as an attitude to overcome, that will really take care of all the problems for the rest of your life. That's why, being youngsters, you got to plug in this chip. As parents, you got to plug in this chip in the brains of your children, right? You really should not be part of that intimidating system. Exams are nearing, are you studying? You're always playing this and that. Don't intimidate, but you can tell in a different way. We have these many portions to cover, come on, let's sit and do it. But however, you can go and play exactly 1 hour, you got to be back, all right, fine. So this is the way how you could instill this chip called as coaching and molding your children, becoming and making them as overcomers. All right, time is going on. A warm welcome again, yet another day, yet another session. And today's topic is a very, very, very famous topic called, we want to entitle as ergonomic issues. Ergonomic issues is gaining lots and lots of importance, regardless of any part of the world you work, any country, any state, any district, any province, any street, any gully. All of us go through one problem in common: ergonomic issues. The olden days, like 4 or 5 decades ago, the problems that they talk in common are cold, fever, and this and that. Nowadays our people are very, very intellectual, they know how to battle against these kind of common health issues, right? And fever, they know what to do; cold, they know what to do; throat ache, they know what to do, which doctor to consult; and stomach problem, they know what to start with, and normal antibiotics, then they go for scanning. All these things, the underlying principle is well documented. And thanks to the awareness that has been brought to this society, thanks to the government of India, thanks to all wonderful doctors, thanks to YouTuber, a lot of YouTubers, they post in a lot of videos. But the most forgotten, the most ignored is this ergonomic issues. People don't even take a note of it, but nowadays the importance is gaining. Now in this session, what we are going to deal with is like two things only: why these ergonomic issues are evolving and how we can deal with these ergonomic issues. And in between these two, I also want to talk about what are the different types of ergonomic issues. There are various, from crown of your head to the sole of your feet. There are lots of parts in our body, lots of limbs and joints and bones and muscles. And our body is like a university. If you have to sit down and research the body, one lifespan is not enough. So wonderfully made, right? Good. Now let's come back to the original topic. Why these ergonomic issues are evolving? What are the different types of ergonomic issues? How are we going to deal with these ergonomic issues? This is not a medical class. I am not a medical student. I do not do my medicines. Therefore, if I am going to talk anything that is outside my reach, outside my knowledge, I am going to be sued. So I got to be very careful. But the little analysis what I have done, I think you will be knowing most of it. But when we present it as a package, it's going to be like an awareness session. It's going to be like a recap. It always helps, right? Now let's talk about why these ergonomic issues are on the rise in the last two, or in the last 1 decade, I would say. The last 10 to 20 years, 10 to 15 years, ergonomic issues have taken its toll. It's taken its rise. Why? The reason is because 8.5 out of 10 people have become workaholics. Will you be able to believe this? You won't be able to believe this, but just research your lifestyle, especially your working style. The number of hours you spend at your workplace, the number of hours you spend in front of your laptop, the number of hours you spend in traveling to your workplace. Yeah. During COVID times we all had this remote working options, but you know what happened? Many people work from home is very comfortable. I don't have to travel in traffic. Bangaloreans were very, very thankful. Why? Because they don't have to go through this potholes, bridge constructions, metro constructions, road has become narrow, deviations, rerouting. Now they don't have to go through all the problems. But you know what happened? They ended up working 40 to 50% more, because the employer had kind of stipulated a rule that you got to be available. Yeah, you have the flexibility, but you got to be available. Earlier you don't have to be available all the time. Why? Because you can always say I'm in transit. You can say that one way I'm taking 2 hours for me to reach home, and the other way it's taking 2 hours to reach office. 4 hours you are outside, out of work, which means you are, which is also a stress. We'll talk about those types of ergonomic problems in a moment. Now what happened is, the statistics says that because of this 40 to 50% improvement in productivity, the employer is able to churn productivity, but at the same time many people fell sick, especially with ergonomical issues. Why? Because too much of sitting before the laptop, too much of focus, right? And what happens is they'll put their neck. Some people you will see, almost they will be getting, so when I come closer you will get scared of looking at my face. Therefore I'm staying here. They will be, why we are analyzing the reason why. The reason is because their neck will be to the front, getting inside the monitor, correct, without your knowledge. I have done that many times. And they don't stand up. We'll talk about the rules, how to overcome. Quite frequently they will be sitting, and the stress levels will increase, which will also contribute to your sugar levels and blood pressures. That's a different topic, I won't get there. We'll talk about ergonomic. We'll only stick to that topic, because it's a versatile topic. Stress is a versatile topic. I'm not getting into that. And what happens is, too much of sitting and too much of focus, too much, and they also end up with eye problems, which is a different topic. Dryness in eyes. Now, so let's limit to ergonomic issues. Ergonomic issues, by definition, some of you may not even understand ergonomy means what and all that. Joint pain, neck pain, and cervical pain. You will suddenly start getting pain here, cervical points, right? And that point can travel all the way to the top of your head. From the top of your head, the pain in here, this edge can travel all the way to the tip of your finger, this entire area. Wrist pain, pain in your forearms, pain in your shoulder balls or joint, right? And pain all the way from the mid of your spine backward. It can travel all the way from starting from L5, L4, L3, L2, it's reverse, L5, L4, L3, L2, L1. If you have a problem in L1, you will have neck problems. You can't turn frequently. You can't lie down. Always you will have pain. You can't ride a two-wheeler. In fact, you can't even ride a four-wheeler. You are not fit for traveling. That's another thing. And as it comes to L3, it's a mid-back pain. It can travel downward. Pain through your buttocks all the way towards the backside of your thigh, towards your calf muscles, backside of your leg, traveling all the way to your big toe, and all the toes. There is a web kind of thing, big toe and the neighboring toe, the pain. This is all L5 and S1. You can Google and see what is this. There are nerves. Our body is made of nervous system and muscular system. Both are to be taken care through normal stretch exercise, relaxing, and this and that, which we don't tend to do when we are workaholics. Now, what is the reason for us to be workaholics? One is COVID. Another thing is like pressure at workplace, competitions, working for promotions, and trying to gain popularity, familiarity, this and that, right? I'm not saying you should stay away from all of this. What to do? Unfortunately, our system is built that way. We all look at our colleagues as competitors. 8 out of 10 people, they always look at that way. Only 2 or 3 people, they fall outside this ladder. They don't care. They are always cool. They always want to contribute. They always want to collaborate, they always want to build people. Such people grow faster than these people who look at others as competitors. The reason for workaholics or workaholism is this, you look at everyone as your competitor, but you always focus, you become narrow minded, you won't be able to contribute outside the box, think outside the box. Understood, huh? So anyway, I'm not getting into that topic. Coming back to ergonomic issue. Okay, why? You almost got an idea. My 10 minutes got over. What are the different types also I touched upon, but some more types are like, uh, while sitting, some people will have over sitting, they will have pain in the side rib, and which can travel all the way towards the side of their legs to their toe, bottom of their toe. That is one thing. Some people while sitting they don't have problem, but as they are walking few steps they can't walk, because they will have problem in their pain around their thighs and knee joints and all that. All are again related to your L1, L2, L3, L4, L5, S1, S2, S3. Three nerves are there in your pelvic muscles, right? It's like a good medical class. I'm talking the truth. This is the way how our body structure is. If I have this L3, L5, same thing you also will have. All are human beings, right? You can Google what is that, body nomenclature or something like that, autonomy of human system. You will know what is that, I forgot that name. There is a name, right? The book which will have all the system defined and all that. You talk to your 8-year-old kid or 11-year-old kid, they will show you books where you can read all the nervous systems. Okay, leave it there. Now other people, right, while lying down, they will have terrible pain starting from their neck all the way to their lower hip and all that. They cannot turn around, they cannot get up from their bed, right? Other people will have problems traveling, they can't sit in their cab or their office bus for more than 20 minutes. Terrible problem. I've gone through almost all these issues. I was able to overcome most of it, but I'll tell you how, with that little thing that I have practiced in my own life, and thanks to all the YouTubers and also some of the orthopedicians whom I have met, and some physiotherapists. Good physiotherapists are very few. Therefore, a lot of people meant a lot of money. They'll make you lie down. They will give you heat pad. They will give you this ultrasound, and they will send you home. They will teach you some exercises which are not relevant, right? And the other type, important type, is sciatica. Sciatica problem is the disturbance. The nerve is pinched. Your L5 nerve may get pinched. Your L2 nerve can get pinched and all that. Other types are disc bulges, herniated discs, and disc compression, right? See, that the spine, how it is built. It's like discs, one after the other. It is built like that. In between the disc, it's a fluid system. So what happens? The more you are sitting, you are imposing pressure. There should be a certain gap between each discs, and that's how the nervous system are built in between these discs, the gaps, no, that's where the nervous system is actually built, and the fluid is basically lubricating it to ensuring that the bones don't touch one another. Now as you sit more, as you put lot of pressure, long working hours and all that, slowly the discs will start coming closer, the fluid levels will reduce. You don't drink lot of water, no? The problem is, I'll tell you, because you're working too long, you don't drink too much of water, this fluid levels will be lowered, dehydration happens in your system. This is true. I've researched and I've consulted few doctors also. Drink lot of water, right? And some people, if I drink lot of water, I have to go for frequent urination. Dude, that's normal. Your system is thanks to your kidneys, they are working fine. If you have to urinate, get a headset, Bluetooth headset. You will be still connected. Go, put on mute, there is a button, put on mute, flush your toilet, come back. What is this, sir? You're talking all this toilet matters and all in this session. It's a very practical problem. All of us attend long hours calls. Some days I am in meetings for 11 to 12 hours. Can I sit there without urinating? I'm very practical, right? This is a practical, nothing to laugh about. Please, drink a lot of water, and build the technology which will enable you to move around. I'll talk about how to overcome. Sorry, I'm mixing between types of problems and how to overcome. Both are important. So side by side we are touching. You understood? The disc space reduces. Therefore, what happens as it reduces, the nervous system is built in this gap, right? In this gap. Therefore, the nerve is getting compressed. Therefore, the nerve is getting pinched. When you pinch a nerve, so no, nothing. You pinch your skin. The pain you can feel in your brain. correct? No, like that. When your nerve is pinched, the pain is not only felt in your brain, your sensory system is also transmitting signals all over the body. Wherever the nerve system is traveling, that is called as sciatica. The nervous system is like a electrical wiring in your house. Electrical wiring is across the house, right? Likewise, it is traveling downwards across. Wherever the nerve travels, that main nerve, sciatica is a main nerve. Whichever nerves are connecting, all the nerves will have that pain. That's why you're having pain all over your leg or body and rib and all. Why am I having pain all over my leg? That's because all the nerves that are connected. But the root cause, too much of sitting. Another root cause, the space has reduced. You understood, huh? Okay. Now these are the different types of issues. Now my 15 minutes gone. Let's talk about how to overcome. Very, very simple. I will not start with the yoga because all of you know yoga these days, and I will talk about the consequences. Not only yoga, physiotherapy, anything. I'll talk about the consequences. Be patient. A very important session. Don't log off. Hang on, another 4-5 minutes. Too much of sitting. The new, the contemporary, in the what is the right term to use? The new terminology for slow poison, according to the olden days, was too much of sugar and alcohol. But I'll tell you, the new killing mechanism in this contemporary world is too much of sitting. It's even worse than too much of alcohol. Don't have alcohol to possible extent. It's even worse than alcoholism. It's even worse than sugar. Adding too much of sugar, eating sweets all the time. It's even worse than that. Always have this principle. Principle number 1. Every 20 minutes, you have to rise up off your desk. Why? Because the blood flow will increase. It will relax your muscles. It will relax your nervous system. Therefore, the stress is not felt in that spine. The stress is not felt in your nervous system. 20 minutes, you have to make it as a golden rule. Get up. Next, principle number 2. Have a Bluetooth headset, possibly, and walk around. 20th minute you get up, you walk around wherever, that limited space. Just walk around a circle for 30 seconds and then you sit, no problem. 20 minutes, rise up. And the second is 30 seconds, 1 minute possibly, or stand for 2-3 minutes possibly, and your system is even more better, right? It's responding. The system is even more responsive. The blood system, the veins, the blood vessels are responsive. It sends that blood. See, I'll tell you when these ergonomic issues are coming. The blood flow is stopped. It's why? Because you are kind of stressing the system with an activity for a stipulated time. Now that's not the way how our body is designed. It got to be in motion. That's why people who are in the mechanical field, civil engineering, construction and all that, they'll be more healthy because they'll be roaming around, they'll be always active. You'll see them, no problem. The white collar job people, where their collar doesn't get turned brown, always sitting in an air conditioned room in front of a system and all that, they will become more sick. They'll earn more and will give more money to the medical system, medical bills and then all that. And these guys will earn less, but they'll be very healthy and happy. That's a problem. Okay, anyway, coming to the original point, right? The third golden rule is drink lot of water. A human system needs 5 to 6 liters of water at least. You talk to any doctor, needed for your kidney system, nervous system, spine system, that fluid levels I told, no, everything for your heart to function very well, digestive system, excretory system, you need water. Drink lot of water, nice water or warm water you drink. It's nice, good for your acidity problems and all that. So drink that. Third golden rule. Fourth is try to get a adjustable desk. It's quite expensive. Recently I picked one from IKEA. You want that link? Ping me separately. I will pass that link. It costs around 16 to 17k. It may sound expensive, but I'll tell you what, it will be very, very lesser than the medical bills that are going to clear in the future. Trust me. I got one for myself and wife. Both of us are sharing and using. It has a pedal. You can this, or the electronics. You are a very rich fellow. Spend some 40k, 45k. You get an electronic system with remote. You press one button, it heightens and then it lowers, which is very important. Why? Because sometimes you could stand and work. This is very common infrastructure or a desk facility that is in Europe. Europeans know, every one of them will follow this. And I've worked in Europe for some time and I know they give a lot of importance to ergonomics. But in India it is not popular. Why? Because the companies cannot afford this infrastructure, right? Because nowadays they are dissolving, shrinking the infrastructure. So if you are able to afford one, afford it, stay at home. And the important next golden rule is, while you're sitting and working, you got to keep a little stool kind of thing, or a little, how do I say, a kind of a short thing that can keep your legs, for example, this is your floor surface, and always we keep our legs like this. No, your leg should be like this. If your seat is like this, your thigh should not land on the seat like this. Your thigh should be like this. Why? Because the pressure on your spine, the pressure on your spine and the tailbone will be lesser. That means the disc will be relaxed. The compression, the disc compression will not take place that easily, right? It should not be at the level. That is one thing. Okay, the sixth golden rule is, your monitor should be at the height of your head, the crown of your head. You should not look like this, you should not look like this. No, both it should be at the same level. The seventh rule is, I forgot the numbers, okay, forget it. Your hand should be on the chair. It should be resting on the chair. So get a armrest, nice armrest. It should not be like this, it should not be like this. It should be at the same level, right? And horizontal. And likewise, your wrist should land on your desk. Your mouse should, you have a mouse. Do not, next rule is, do not use the mouse pad in the laptop. You will end up with all sorts of ergonomic pain. Please use proper mouse with a mouse pad. Mouse pad should be ergonomically made. Your mouse pad should have a bulge where you could land up your wrist, and you could comfortably, a smooth landing platform with a sponge kind of thing. And you could use your mouse, right? Mouse, you will hold it in your fingers, therefore it will be distributed. You use only this finger, no, forefinger, then you will end up in all sorts of problem on a longer run. Trust me. These are the ways to overcome the ergonomic issues. Now getting into the exercise mode. Sorry, my time is up actually, but very quickly I'll tell you. Go for yoga, go for physiotherapy, no problem. But I'll tell you what, my experience, not all exercises will suit you. Some exercises will not suit you. Why? Because you started at a later point of time. You are not a 5-year-old kid. You are not a 2-year-old kid. You may be a 30-year-old professional or a 40-year-old professional, 45 midday. Suddenly you cannot start yoga and all that. Your system won't adjust. Your nervous system won't understand. You're stressing it all the more. So find a good physiotherapist, find a good yoga therapist, and that person will examine your body, and that person will help you to start with basic exercises and put you on that for a basic exercise for 2 months, and they will see how the system is reacting. Then they will increase it. Then they will moderately, progressively, gradually. You got to increase the exercise levels. Only then your system will be adjusting. All of a sudden, don't start all 25 exercises. You will be bedridden. I was there. You will end up in sprains. You will end up in all sorts of muscle spasm. Your muscle will become more tighter. Muscle is already tight. You got to flexibilize it, right? So slowly you got to do it. So find a good physiotherapist. Do all sort of stretch exercises, the camel exercise, and the cat exercise, and the dog stretch exercise, and putting the chest to your feet. You know all the exercises. There is no education needed. But what suits your body, only a physiotherapist can find out. Work with the right physiotherapist. There are a lot of people who are always in rush, teaching everything that they know. No, that's not the right thing to do. Okay, my time is up. Thank you for listening. I hope today's session was useful. You need more extended topics on this ergonomic thing, let me know. Very interested. Why? Because I've gone through a lot of pain. You also would have gone through, all our human beings know, you also would have gone through a lot of pain. We will help each other. Okay, one last advice I'll give you. We all go for walking. We all go for gym and all that. Do not run like this. Have a normal walk, right? The normal smart walk, at a brisk walk they call it as. Take short steps. Don't take long steps and go and all that. Short steps. Walk for 40 minutes, 35 minutes, enough. Don't stress yourself walking for 20 kilometers and all that, right? Normal. Exercise well, stretch exercise, walk normally, and you will be staying healthy, right? What is important is, I got to be slim. I got to build my muscles like Arnold Schwarzenegger and this and that. Why? What are you going to do with that? That fellow himself has retired, right? So chill, right? You got to be fit. Fitness is not about your 6 packs and 20 packs and all that. So don't go for all that. Fitness means you got to live your life without pain. Any part of your body, you got to be fit. Understood? All right. God bless you. Take care. Thank you for listening. Stay connected. We'll come up with yet another session. God bless. Namaste.